This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Prostate cancer is the most common non-skin cancer in men in the United States, with nearly 270,000 new diagnoses annually. Most of these are what we call clinically localized prostate cancer, cancer that hasn't yet spread beyond the prostate. But don't be misled by the word localized. While the disease may still be contained, the decisions that follow are anything but simple. Today, we explore how localized prostate cancer is diagnosed, classified, and treated, and most importantly, how these choices can impact not just your survival, but your urinary health, sexual function, mental well-being, and overall quality of life. Think of the prostate like a walnut-shaped valve at the base of the bladder. It helps control urine flow and plays a crucial role in reproduction. Localized cancer means the malignant cells haven't spread beyond this organ. But within this category, not all prostate cancers are the same. Doctors assess risk based on three key factors: PSA, a protein in the blood, Gleason score, or grade group, and clinical staging. These data points help classify the cancer as low, intermediate, or high risk. Low risk often grows slowly and may never become life-threatening. Intermediate risk varies in behavior and needs personalized discussion. High risk is more aggressive and may need combination treatments. Cancer arises when abnormal prostate cells begin to grow uncontrollably. Some are indolent and slow. Others are aggressive, capable of invading nearby tissue or metastasizing to bones or lymph nodes. PSA, digital rectal exams, DRE, biopsies, and now even multiparametric MRI and genomic biomarkers help us distinguish between types. Imagine the prostate as a gated community. A low-risk cancer is like a noisy neighbor, annoying but not dangerous. A high-risk cancer is like someone with a battering ram trying to break down walls. We need to tailor our response accordingly. We've known about prostate cancer for decades, but how we treat it has changed dramatically. The 2022 AUA Astro Guideline offers a rigorous, evidence-based framework. It recommends active surveillance for most low-risk patients, while offering tailored combinations of surgery, radiation, and hormone therapy for higher-risk cases. These guidelines are built on thousands of studies, including large trials like PROTECT, which showed that survival rates for low-risk patients were similar whether they had surgery, radiation, or active surveillance, highlighting the importance of thoughtful decision-making. Despite prostate cancer's prevalence, awareness lags behind. Men often avoid discussions about urinary or sexual function. Primary care physicians may not always be up to date on guidelines. Media rarely covers it, and screening practices remain controversial. Add to that disparities in healthcare access, especially for African American men, and the picture becomes more concerning. Many men are overtreated, while others who could benefit from early intervention are missed. Treatment for localized prostate cancer ranges widely. Active surveillance involves regular PSA checks, biopsies, and MRIs, but no immediate treatment. Radical prostatectomy removes the entire gland, often with nerve-sparing techniques. Radiation therapy includes external beam or seed implants. Hormone therapy is added for some intermediate and high-risk cases. Each has trade-offs. Surgery may affect urinary control and erections. Radiation might cause bowel symptoms. Hormone therapy can reduce libido, energy, and even impact mood and bone health. But today, we're better at managing side effects, thanks to rehabilitation, medications, pelvic floor therapy, and support groups. At my practice, no man gets a copy and paste treatment plan. We integrate tools like nomograms to predict recurrence risk, genomic tests like Decipher and Oncotype DX for added clarity, and imaging tools like MRI and PSMA PET to rule out hidden spread. We also assess what matters most to the patient. Do they prioritize longevity, erectile function, avoiding invasive procedures? Those answers shape our recommendations. Let's talk results. For low-risk cancer managed with active surveillance, 10-year prostate cancer-specific mortality is less than 1%. For intermediate and high-risk cases, combining surgery or radiation with hormone therapy improves survival significantly. Newer techniques, like robotic-assisted surgery, hypofractionated radiation, and even focal therapy for select men, are pushing outcomes even further while reducing side effects. But beyond statistics are stories, men who return to work, regain intimacy, and reclaim their lives after treatment. What's next? We're seeing rapid evolution in prostate cancer care, artificial intelligence to interpret MRIs and pathology, biomarker panels to personalize therapy, next-gen imaging like PSMA PET for better staging, and telemedicine to keep men connected to care. And on the horizon, immunotherapy, targeted therapies, and possibly even prostate regeneration. We are moving away from reactive care toward precision medicine. Targeted, data-informed, and compassionate. I became a urologist to help men live better, longer lives. But too often, men walk into my office with fear and confusion. My mission is to change that, to bring clarity where there's doubt and confidence where there's fear. Prostate cancer may be common, but that doesn't mean your treatment should be. It's your body, your future, and your choice. Thank you for listening to the Global Men's Wellness. I'm Dr. Judson Brandeis. Stay informed, stay empowered, and take charge of your health. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.